Try this again. Thank you so much, Connie, and Teresa, for your inspiration. The inspiration, pardon me? Can you hear this?
Oh, yes, we can hear you.
Is that clear?
Yeah.
Okay.
We can hear you fine.
My name is Rose King.
Hi, Rose.
I'm a partner with Teresa in founding Mental Illness Facts and launching all of you We Are the Front Line and the campaign for a right to treatment. It's a campaign that's been going on another front for some time, and we do have standard bearers and role models to look toward, fortunately. My notes about Helen Thompson and introducing her really are all in my head, but I have to say I met her first when she was recruiting. She was a county supervisor and recruiting more women to run for public office. And she was active. She was active when the 1991 realignment was hammered out. So she's very familiar with the whole funding formula, and of course was a psychiatric nurse, RN, in her other life. And her husband, Cap, is a psychiatrist who is still practicing and would be taking Medi-Cal if everybody didn't have to go to an HMO today. But he did for some time. Anyway, Helen persevered and passed for 4 years, to pass the landmark Mental Health Parity Act of California for people with private insurance. And for anyone who recalls circumstances prior to that, you appreciate the difference when hospital days are limited to 20 a year and visits to 8 a year and so forth when a person has serious bipolar disorder or other conditions. So Helen passed that landmark bill. She went on to pass 2 other mental health bills that you're very familiar with, and I think she is known for persistence, and known in these halls, I think, for persistence, and for that persistence translating into success. She is actually a whatever it takes person, contrary to, I hate to use that mantra that's placed on some of the Prop 63 programs, but, and she laid the foundation for Prop 63. Helen introduced a bill after we had 5 reports condemning California's mental health conditions. She introduced the omnibus bill, and the only bill that struck the language that says mental illness treatment is available to the extent resources are available. Her bill would have struck that language, and of course it didn't make it through. Part of it made it, and then the governor vetoed it. So anyway, it's a great pleasure to welcome Helen Thompson and her inspiration and persistence.
Thank you, Rose. I haven't been back here to speak at a rally since I left, and so it is kind of deja vu as I look out and see all the wonderful placards and the t-shirts. And the only reason I came today is Rose and your efforts to make sure that there is a right to treatment. I've never quite understood the humanity that gets in the way of our rights, our lack of the right to treatment for the mentally ill. Rose gave you an introduction. I would like to say that I am a proud, stubborn Scot, and the title that John Burton gave me as he fought with me over Laura's Law implementation was that I was stubborn Scot, and I am very proud of that designation. But I'm here today to support your efforts and to do what I can in some small ways on this effort for the right to treatment. AB 88, as you all know, the mental health parity, is a guarantee of equal treatment for mental and physical illnesses. The medically necessary services for mental illnesses are provided under the same terms that apply for physical illnesses. So parity under the law means equity, means equality, it means the same, it means no discrimination. What I did not know when I first worked in the with my legislative colleagues to pass AB 88 is that in Medi-Cal, the public mental health system, there is no entitlement to medically necessary treatment. Due to the federal waiver, parity does not apply. Discrimination against those who are mentally ill and who are denied treatment is like saying to a person with type 2 diabetes who already is insulin resistant, obese, and has hypertension, and whose illness would progress to heart disease and a stroke, that they would be not eligible for treatment under Medi-Cal until they need dialysis for their kidney disease. Think about that, because that's exactly what's happening. Not eligible for treatment until you need dialysis. We do that in a very different way to the mentally ill. This lack of parity or equality of care in the public mental health system is discriminatory, and it will get worse. Currently, there are over 600,000 Californians without treatment or who are undertreated, and yet the just passed state budget adds over 1 million new Medi-Cal, Medicaid enrollees. Coupled with a 10% reduction in provider rate cuts, how will these mentally ill people find services? Access is meaningless under those conditions, meaningless. I believe it's time in California to again fix the mental health system. We've had various reforms, they come about every 20 years, and about 20 years is up now, and it's time for reform again. The state's jammed ERs are now the first line of defense. 33% of our jails and prison cells are occupied by a person with mental illness, and the homeless mentally ill are still victimized on the streets. Those were facts, but we've just added more zeros to their numbers 20 years ago. All of this is due to a lack of entitlement to care. It is time to call upon our legislature to fix the problem. The federal waiver is up in 2015. This is an opportunity. Seize the opportunity. A plan for change is needed by then, a plan for change that matters. I believe that's your slogan, a plan for change that matters. This plan should include parity, integration with mainstream physical health, as the Affordable Care Act calls for, accountability for standards of care statewide. There is vast discrepancy in the services and the quality of services in our state from border to border. Accountability for those standards. Change that matters includes safe, effective, timely, efficient, equitable, and patient-centered mental health care for all Californians. It is time for real parity. It is time for action. I believe we have that opportunity. We have some very fine legislators interested in these issues, working hard on them already. And I think it's possible to put together a nice task force that could, in fact, review the reports that have come over the last several years. There's certainly enough reports. And there's a lot of facts in those reports. There's interested consumers and interested families. And please, the last thing I would say to you is continue to tell your stories. Parity would never have passed. Laura's Law would never have passed. Many of the mental health laws that I worked on would not have passed if families had not come into the legislature and sat in hearing rooms and told their stories. So please continue to do that, as hard as sometimes it is. And thank you so much for all that you're doing. I'll work with you on this one. Thank you.